Next, we have a roundtable with industry experts, Leanne Webster, Dr. Cheng Ron, and Dr. Innocent Clement. Each have made significant contributions to the industry, and I'm excited to hear their points of view on the future of health coaching. Leanne Webster served as the Executive Director for the National Board for Health and Wellness Coaching, NBHWC, since 2015. This is a nonprofit organization that has created a professional standard for health and wellness coaching and fostered a community of more than 3,000 national board certified health and wellness coaches throughout the world. Dr. Innocent Clement is the founder and CEO of Evolved Health, a former McKinsey consultant and the former CEO and co-founder of Kaya Health, a digital therapeutic company. He's a trained physician from both Columbia and Harvard University. Dr. Cheng Ron is a functional medicine practitioner and founder of the Texas Center for Lifestyle Medicine. He's been practicing for 11 years and comes from a family of Chinese medical doctors who focus on natural healing and using food as medicine. This combination of Eastern and Western methods is what makes Dr. Ron unique in his approach to health and wellness. Thank you all for joining us. I'd like to open with our first question to Leanne. NBHWC formed in 2012 and is the gold standard for health coaches with the highest level of training and expertise. Can you tell us about the growth of the profession over the past 5 years and what you think is the forecast for the next 5 years?
Well, first I want to thank you for having me today, Sandra. It's been a pleasure working with you and the entire staff at FMCA. You guys just do amazing work, and it's really nice working with so many of your coaches. In terms of where have we been in the last 5 years? Well, I joined the organization 5 years ago, and at that point, I was the first person that they had hired, and it was really just getting our ducks in a row to be where we are today. So at that point, the standard, the board of directors was just finalizing the standards for the profession. And we launched program approval in July of 2015. I remember talking with Margaret Moore about it and thinking, what in the world is program approval? What in the world are we going to do here? But it all came together very nicely. And one of the really cool things was that at that time, I remember Margaret and I talking, and we thought there would be maybe 10 to 15 programs that applied for approval, and it ended up being over 60. So there was actually a lot of growth in the industry that we weren't even totally familiar with. So since that time, we have transitioned from our initial standards to more robust standards. We now have over 50 programs that are approved under these new robust standards. We've partnered with the National Board of Medical Examiners. We began that relationship in May of 2016. They're a very integral part of what we do every day. And we like to say that they're experts in exam creation and delivery. And then our side, the National Board for Health and Wellness Coaching, has really developed amazing content for that exam. So we've launched the exam. We've had the exam 5 times. We now have, as Margaret mentioned, more than 3,000 National Board Certified Health and Wellness Coaches. And I think that the biggest thing that I'm seeing now is the number of phone calls and emails that we're receiving from healthcare organizations or employee wellness programs, or even private industries that are reaching out to us and asking about the National Board Certified Coach. What does this mean? What can this mean for my employees or our patients? So I'm seeing a real uptick compared to where we were 5 years ago in our, I guess you could say, value in the health and wellness industry as a whole. So I think that's kind of a picture, a snapshot of where we've been over the past 5 years. In terms of where I think we're going, I think, as Margaret mentioned, we now have the Category 3 CPT codes for health and wellness coaching, and that was just a tremendous effort. I think we're still in the middle of that tremendous effort, and we will be for a while. But what the Category 3 codes have done for us is really opened the door in healthcare for more respect and more conversation, and obviously data collection, which needs to happen. But where I see us going is, moving to a Category 1 code that is reimbursable, and then also establishing really strong relationships with third-party payers throughout the U.S. As Margaret said, there are tons of them. We've identified more than 900. So I see us really integrated onto that healthcare team, and that health and wellness coaches are extremely valued in the healthcare system. That's my long-winded answer.
Yeah. So I'm assuming then it is so important for coaches to train with an NBHWC approved program.
Absolutely. If a coach would like to become board certified, they definitely should attend an approved program.
Let's talk about career opportunities. Leanne, what changes have you seen since you started with the National Board?
So, well, because of the standardization of the profession, we've seen growth in all areas of healthcare as related to the health and wellness coach. So, we're seeing it in primary care practices. I actually was on the phone yesterday with an emergency medicine physician who was talking about bringing a health coach into their clinic. So we're seeing it across all aspects of healthcare. And then also with a lot of industries are bringing in, like the manufacturing industry, the automotive industry, they're starting to bring board certified health and wellness coaches onto their staff to work with their employees. I'm also seeing and receiving phone calls from self-insured organizations or companies, unions that are also starting to think about bringing on a health and wellness coach. A lot of times they do ask about the evidence, and luckily, as Margaret mentioned, we're able to share that compendium, which is really valuable. So yeah, I'm just the volume of interest that we're receiving about board certified health and wellness coaches, it has definitely increased.
So encouraging to hear. So this is a great segue for Dr. Ron. Dr. Ron, there have been many promising developments in remote patient care. Can you tell us how coaches play a major role in remote group visits at your Texas Center for Lifestyle Medicine?
Yeah, Sandy, thanks for having me. And if you're just joining on live, my name is Cheng Ron, a board-certified internal medicine physician and founder of Texas Center for Lifestyle Medicine. If you're on YouTube, go ahead and click that subscribe button and give a thumbs up, because I'm going to go into some very interesting things that I don't think we've been really asked in the coaching world. But Sandy, I want to address that question is, how do you see patients virtually? What's the benefit of it? And how have we been doing it here? And more importantly, how do we get paid for it by Medicare and other insurances, right? And I think if we can address all that, we have a victory. And so, I want to give a big shout out to Jenny Moreno and Jillian Reisick, my two superstar health coaches, who helped me develop our chronic care management program and our remote patient monitoring program here. And it's been a whirlwind year and a half into the development, and we're continually making changes to accommodate for COVID. So one thing that I want to bring up before we get into your question, Sandy, is really what is the role of health coaches. And I think if we understand that first, then you'll kind of answer why we wanted to do virtual coaching programs. So the role of the health coach is not just someone who's an advocate for a patient. The role of a health coach is to stuff a lot of value into what physicians do, whether it's an emergency medicine doctor, primary care physician, orthopedic surgeon. And it opens up something that's been missing in healthcare, which is called meaningful conversations, right? In order to establish a physical connection and emotional connection, as well as a professional connection, a meaningful conversation has to occur first. And from a physician's standpoint, it's really hard to have meaningful conversations when we have a volume of patients coming in. And not only that, there has to be a direct line of communication that is far more robust than what traditional medicine has been, which is through medical assistants, front desks, and stuff like that. And so what the health coaches are really truly bringing value is facilitating those meaningful conversations. And so we can decrease the rates of hospitalizations, medical errors, prescriptions, and whatnot. And it became real apparent since the pandemic that this is truly needed, and it's truly a missing component. So because of that, because of the fact that we have to have these meaningful conversations, there can't be delays. And this is where virtual coaching comes in, right? Online coaching. And so it allows us to have those more meaningful conversations with less of a barrier. Phone calls, televisits, and whatnot, right? And so here at Texas Center for Lifestyle Medicine, back in February, we had to do a massive pivot. We went from 10% telemedicine to 90% telemedicine to accommodate for all the stuff that's been happening in the last few months. And so the virtual stuff really had to happen. And then we had to stop our in-person group visits. And I love our in-person group visits because our coaches run them as well. So when we started utilizing different platforms on Zoom, and we worked with several other tech startups on getting patients into some sort of a tech platform where we can continue to access the elderly and people who aren't tech savvy. And so all that has been really going on, and we were really in a big hurry to get people to adopt the process. But what the pandemic has allowed people to do is to adopt it at a much faster rate because they're in quarantine. They can't really go anywhere, right? And so I think that virtual group coaching programs is even more efficient when there's a desirable outcome and when you can have an even more meaningful conversation in a group. So we have, for example, Jenny runs our group Tai Chi, which is actually very popular because it's something that people can do at home and it's not distracting. You don't have a lot of negativity coming in on social media feeds, and it's that time is for yourself, right? So when people are put into a physiology of calm, meaningful conversations can occur on the follow-up physician visits, on the follow-up dietitian visits, right? On the follow-up one-on-one coaching visits, right? And so I think that the role of a health coach is someone who generates and facilitates meaningful conversation to those who are trying to serve. And because of that, I see the health coaching unit as the center structure of a practice, and the providers are the ones that actually support what the health coaches do rather than the other way around. Because we tried the other way around back in 2018, didn't work very well. But when we see our entity as a health coach-centric unit of an engine that creates these meaningful conversations, now our outcomes are significantly better for acute or chronic disease. And that's what really makes this a very interesting platform.
Wow, that is so exciting. What would you say your estimate would be how many health coaches are needed in the future to assist with remote care as you're describing?
Great. So this is actually a really easy conversation. It's going to be a lot more than what exists right now, and I'll tell you why. So, we've talked about Category 1 codes that pay and Category 3 codes that are temporary or trying to get data from, right? From CMS or Center for Medicaid and Medicare Services. Well, right now there's actually plenty of Category 1 codes that the health coach can facilitate in billing, right? And so, for example, if I'm a physician, I want to communicate with this person's primary care, with this person's, back surgeon, There's physician-to-physician communication codes that are Category 1 that started in 2019. There are non-face-to-face indirect contact codes that deal with the patient diagnosis. That's existed since 2020. And 2021 CPT codes came out, I think it's October 5th, which is 2 days ago. And I was actually looking on my phone during the beginning of this because I just got that email. And it seems that there's a lot more that we can actually do in 2021 that the health coaches can facilitate. Now, this is something that's new, so it's going to take some time to adopt, but I think, with the people on this forum, it's going to be a much easier conversation. We can work together to formulate a new type of workflow within the medical practice and redesign how the medical practice really works to decrease the pain points on the patient side, decrease the pain points on the physician side, and all the entire staff. And that's what we are very obsessed about doing currently here at Texas Center for Lifestyle Medicine. And so I do think that there's going to be a massive explosion of the requirement for health coaches. And the second thing is, right now, a lot of the backbone structures for medical practice are medical assistants or MAs, right? So medical assistants do everything, and they don't necessarily have to, because a huge portion of it could be dedicated to the health coaches having those meaningful conversations. Medical assistants can do some of the more administrative stuff, and that actually streamlines the process. And overall, it actually decreases fixed costs in a medical practice. And this is where we need to get the numbers, get together, get the numbers to look at private practice through accountable care organizations and looking at larger practices and seeing what we can do. So that's really upcoming for us in the first quarter of 2021. We're going to be really diving into what the cost savings truly are.
Very exciting what is on the horizon, and your center is certainly a role model. And there's another role model, and that is Evolved Health. And I'm excited to hear from you, Dr. Clement, about Evolved Health and how you use health coaches in this virtual practice model.
Okay, thank you so much, Sandy. I want to extend a very big thank you to you and the entire team for really putting this together. I think this is really, really needed at this time so that people can begin to understand the importance of our health coaches in our healthcare model today, because they are really an integral part of what we do every day in the healthcare. But again, not a lot of information is out there. Not a lot of people know the value that health coaches actually bring into, when you're looking at coordinated care. So for us at Evolve Health, we really identified that quickly when we started, given that what our approach is. So again, I will quickly introduce Evolve Health, what we currently do. So Evolve Health is a digital functional medicine platform, right? So we use the functional medicine approach to really personalize healthcare for patients and begin to understand what are the root causes of some of this healthcare and see how we can really reverse it. So what we did was we created what we call the multidisciplinary approach or the interdisciplinary approach, where the doctors, the health coaches, the dietitian are all collaborating. And the goal is to see how they can better support and empower patients as they go through their healthcare journey. Because right now, what's really missing in the health system today, if you look at the conventional healthcare system, empowering patients, really, it's something that's not there. You want to empower them to be able to also optimize them, right? Current healthcare system is also really the conventional healthcare system today, or traditional healthcare system. It's really very doctor-centric. It's not really patient-centric. So the health coaches really, they are an integral part of that process. In terms of coordinated care, it's really their role. It's really, really important. And then that's why we as a company, as an organization, we know that yes, they have to be a part of the process. Our patient come to the platform. The first thing, they complete all the questionnaire and they get to speak with the doctor. The next step will probably either the doctor will recommend that they talk to a dietitian. And then from that, the next step is, okay, you have spoken to a dietitian, there's a plan in place. Because again, we all know how difficult behavior changes is, right? Because again, most of the chronic disease conditions we have today is as a result of lifestyle changes, and sometimes again, behavior changes also contribute to that. And it's so difficult to do, even when you have a patient, you put a plan together for the patient, go home and then follow through with this plan. Sometimes, again, we know that the world we live in now, there's a lot going on, there's a lot of distractions, so a lot of patients really don't really have that. If they need that support, someone who's going to really hold them as an accountability partner. So that's how, we see our health coaches play an integral role into our healthcare model, because education is really important, providing the moral support and encouraging them as they continue to grow through their healthcare journey. So, I mean, they are really an integral part of our model, and it's really very important. And we're excited for what you're doing for us. When we launched June 5th, the first thing we did was to reach out to your organization to recruit coaches from your organization. So all our coaches today, we have, I think, 15 health coaches. All of them, I think, came in from the FMCA, Functional Medicine Coaching Academy. So really would say a big thank you for all that you do, and really they are really an integral part of what we do every day here at Evolve Health.
Thank you. We are honored that you have trusted us and our graduates. AI, technology, this is a significant part of healthcare and in the future. Can you share your vision for the blending of health coaching with remote patient monitoring through wearables?
Absolutely. This is another exciting part of what we're doing, because we understand, again, really, if you want to scale, given that the human resources, again, the limit to that, there's always a limit. Again, for us as a company, we just don't want to be here, within the US. We want to be able to go globally, right? So we leverage technology as well as the health coaching that would also provide that support, right? To ensure that we're able to scale, we're able to reach as many patients who are across the globe, wherever they are. So we quickly understood that, and what we did was to identify partners that can really provide us those tools that we're able to integrate into our platform. So one of those partners that we identify is, and I'm sure you're aware, Heads Up Health. It's another remote patient monitoring platform. So we quickly integrate that into Evolve platform. So it gives our patient the ability to really track their progress, as well as they work alongside the health coaches. So the health coaches have access to the patient data in real time, and they look at the trends over time and identify any areas that are red flags and see how they can better support the patient and, as they continue. Because a lot of times, again, patient, you're busy with your life and all of that, and then you don't really, sometimes you forget, right? So with that integration to the remote monitoring tool, we as the health coaches are able to see that, visualize that data real time. And then quickly, if they identify any red flag or any abnormalities in the data, they will quickly reach out to the patient and see how they can better support this patient. And if there's a need, they will bring them back and say, hey, I think maybe we can come back in and then speak with the doctor to let's look and evaluate and ensure that there's we're not missing anything at all. Because again, they would have to look at that over time, right? So let's say a patient is on who is also integrated into the platform. You observe that data over maybe a few days, and you see that it's trending upwards, or it's not within the normal reference range. Obviously, that's like almost a red flag. Sometimes the patient might not even realize that, right? So the health coaches, they will quickly really reach out to those patients and say, hey, Mr. B, I think I noticed that, again, in a way that it's not going to scare the patient, but again, so the patient can understand that you're there to really support them and empower the patient. You want to understand if something has changed, you just want to, and then the patient will be able to share and say, hey, maybe I did something, there might be something that has changed that you're not aware of, and the patient might be able to share that because you're there as an accountability partner and also to support that patient as they continue with their healthcare journey. So, and then, the AI part, like you mentioned, right? So for us, it's to be able to really look at it and then identify, so it's for predictive analytics, right? So what it does is it's able to predict and identify where, if anyone is at high risk of developing certain disease condition based on the data that we're seeing from all its wearables. Because Heads Up Health, it's able to integrate into Fitbit, Apple Watch, Keto Mojo, Oura Ring. All those are healthcare devices that would provide you with data parameters that you want to measure as you continue to look at, supporting this patient. So the AI model is trained to begin to look at the data to identify high-risk individuals and predict them before they even happen. And the health coaches will look at this data and be able to now look at it. And it's okay, looking at what we're seeing now, we should be able to now say, okay, there might be an issue here. How can we now really, they begin to put a plan together, how they can really support this patient and approach them and then provide them with recommendation, or really if there's some way to probably educate them or bring them back in and say for further evaluation.
I love this. And Heads of Health, this is a dashboard where you can see at a glance the data from all of your devices. So this is very promising and exciting. I'd like to turn back to Leanne. What is the board doing to grow the field of health coaching? You mentioned so many things that you're already doing. Anything that in the future, or more specifically, what you're doing?
Yeah, so that's a great question. One of the things that we're doing a lot, but one of the things that we're doing is really reaching out deliberately to healthcare organizations. And obviously, we're going to be reaching out to payers and to any organization really that could benefit from knowing about health and wellness coaching and the field. So for example, like I recently reached out to the American Cancer Society, just let them know about us. I saw something recently on social media about the Army was bringing in behavior change specialists. And I immediately got on that and was, found out who I could connect with to really educate them about health and wellness coaching. So I think one of the things that our organization is focused on is creating a lot of awareness about health and wellness coaches and about the training and education standard that now exists. One of the things that we need to do more of, Sandra, is actually reach out to the public. So, because there are many coaches out there who are employed, right? But there are also many coaches out there who want to be self-employed. So it's incredibly important that we educate the public about the profession of health and wellness coaches and what they can do to help people have better health outcomes. So we're not doing that as much now as I'd like to be, but that will definitely be one of our initiatives in 2021.
I love hearing that, a public awareness campaign, because so many people don't know about coaching or don't know what they do or what they should not be doing.
Exactly.
Yeah. Margaret, you talked about we're all in this together and we need to come together and work to grow this field. Leanne, what can health coaches specifically do to advance the profession?
That's a great question. I think health and wellness coaches who are self-employed really need to come to the table with a strong understanding of the evidence that is out there, right? They need to really understand and take a look at that compendium that Margaret referenced, the compendium of health and wellness coaching literature. And I'm happy to share that with anyone who wants to send me an email. But I think they really need to come to the table educated about how this profession has grown. And I think that they, should be approaching people who could benefit by working with a health and wellness coach, or approach physicians or healthcare providers who would benefit by having a health and wellness coach on staff. So I think just coming to the table with a real understanding of what you do and how you can actually help people.
I love that. We tell our graduates to track your outcomes and keep that data so that you can let people know how effective this is. What do you think are some of the biggest challenges that may lie ahead, and how can we work together to overcome them?
I think I say this daily, which is we're doing something that's never been done before. And so one of the biggest challenges is really figuring out how to do it, right? So when we're working with CMS, who oversees Medicare and Medicaid, trying to figure out that language and how we can best, work into that system. So a lot of what we're challenged with is just doing something that's never been done before and figuring out the best way to go about doing it. I think, you know, kind of speaking about your first question and this question, one of the things that coaches can do is if they are working in healthcare or they are working in an organization employed as a health coach, they should reach out to us and they should let us know about what they're doing, because there's always an opportunity there for us to work together and to together overcome the challenge of doing something that's never been done before.
That's a great idea. Thank you. So back to you, Dr. Ron. What do you think the future looks like for medical practices, both conventional and integrative functional medicine practices, around hiring health coaches?
Yeah, that's a great question. I think we have to design the process first, as Leanne was talking about. This has never been done. What we really have to do is get the message out there for practices, large or small systems, that there are specific pain points in medicine that can be very easily addressed with health coaching. That's always been a missing component, but we have to be able to demonstrate that it actually works. I think the future is bright, and I think the future is going to be paved with a lot of uncertainties as well. And so those uncertainties are, okay, well, how does this work as a business? What is the reimbursables and collections? What are the new CPT codes that are that are published by CMS? What is the fee schedule? You know, and all these different uncertainties are something that we really have to keep our pulse on, and then actually have case studies. So, you know, I see my facility as an initial case study for a lot of how the health coaching works. So I'll tell you what, 90% of what we do doesn't work. The 10% that do is what we're going to continue to focus our success on. But there's still going to be a challenge going into the future. But I think that, you know, Sandy, I think right now, you know, before we hit 2020, 2021 is the time to really just be laser focused on how the system can change, right? And so you're talking about, you know, integrative health versus conventional medicine versus whatever it is that we want to call it these days. I don't really distinguish the type of medicine. I think that health coaches are going to be a missing piece into practicing good medicine with good outcomes, with cost savings, right? And so I think that with what's going on with the pandemic, a lot of conversations are opening up and people are just uncertain. And I wrote a LinkedIn article yesterday morning about how the uncertainty has created all these messages that come in, and people are reacting to tweets, people are reacting to Instagram posts and CDC announcements, all that stuff like that. And so, you know, part of what our health coaches do is to facilitate that conversation and refocus on things that truly matter, right? And so I think that when we are able to show that we can demonstrate that we're providing people with certainty, that we're providing people with a way of communicating, that communication can be reimbursable, and that communication can be scalable. And, you know, I think the future is bright. There's still some humps to go through, but if people continue to kind of keep the pulse on exactly what's going on in the world, I think we're able to create a system where we can pivot with the changing times. And that's truly what's exciting to me.
Oh, it's so beautiful. And I could hear your excitement.
Yeah.
If doctors did not go to medical school to learn how to work with a health coach, and any suggestions for coaches who are listening or prospective coaches, how they approach doctors, how do you sell the value of a coach?
That's a really good question. So this is one of the most commonly asked questions that I get from coaches is, you know, sort of, how do I market myself? Like, what do I do with my skills? How can I insert myself into a system, right? And my best advice is to actually know your numbers, know how you can potentially facilitate a doctor's workflow. And so to know that, you have to know what the workflow actually looks like, and then reverse engineer yourself into the actual system. And how do you get that information? Well, the American Medical Association has published a lot of workflow facilitations. The American College of Lifestyle Medicine has created beautiful blogs on how possibly coaching can facilitate that, or having an extra staff to manage some of the outcomes. There's new articles on how a clinical staff, they call it clinical staff, let's just call it health coach, and how a clinical staff can facilitate CCM, which is chronic care management, as well as RPM, which is remote patient monitoring. And so that's where I get a lot of my ideas from, and the engineer process that really works for us. And I think that all coaches really have to be plugged into to that system. So it takes a bit of research, but I think it's totally doable.
Absolutely. Dr. Clement, as we look at the future where health coaches are going to play a major role, can you share your insights and your vision for evolved health? And also walk us through in more detail. I love this pilot program that you're doing with Heads Up Health.
Absolutely. Thank you, Sandy. That's also a great question. And like you know, we're all excited at Evolve Health, having the opportunity to be able to really, like you said, again, it's really a very difficult time that we are in right now. COVID itself has actually accelerated, has completely changed the healthcare landscape completely. And I think it's for the better, hopefully, given that now a lot of patients right now, when you see that most of them, I mean, the data out there, 70% of the patients, they're actually worried or concerned actually even going to the physical locations now. They would rather look for an opportunity to go to an online platform where they can access healthcare. So when we look at all that, we look at the data, really, it's exciting. We know that, yes, it's an opportunity for us as a company to really key into that and see how we can really provide value. And my keyword is always how we can really optimize patients and empower them, right, to really continue to improve their healthcare. So the health coach is an integral part of what we do every day. As I mentioned earlier, from day one, we know that we need the health coaches. I know it's a very difficult thing to do, really, given the healthcare system, the way it is structured. It's really doctor-centric. So, but what we understood is really communication and be able to also show the value of, because the most important thing, if you look at chronic diseases, again, it's looking at engagement, behavioral changes. How can you really get the desired outcome for your patient if really you're not able to identify the ways that you can really help to support this patient and encourage them? So doctors alone, again, they're so busy. A lot of times after you see a patient, they're probably either doing the administrative work, filling out the notes and all of that. So someone needs to really continue from where they stop, right? So that's what I say, and then that's what I tell my patients, and that's what we as a company at Evolve Health really are able to really do, because we know that it's a huge value. It's not just the doctors, but it's had to be a coordinated, collaborative care that would include the doctors, the health coaches, the dietitian, so that we can really look at it in the big picture. We all have to work in a collaborative environment. That's not like, okay, I'm a doctor, yes. But again, the health coaches might have some ideas as well, right? But again, the most important thing is the ability to listen, to communicate clearly, to understand what is the plan, for this patient. First thing you look at the patient, yes, engagement is important. How can you get this patient engaged? How can you get this patient to really change whatever behavior or whatever lifestyle changes that the patient needs? Doctors alone cannot really do it. So one of the reasons why we decided, yes, it's important, we use technology, we use health coaches, and then why we actually partner with Heads Up Health to really provide that remote patient monitoring, working alongside with our health coaches that will be looking at the data all the time and be able to reach out to this individual patient and then be able to provide support, again, education, and how can you really support and empower this patient. So the current, like you said, the question about the current pilot that we're doing now, it's we understood quickly also to provide training. So we identify some of our health coaches within the platform and then provide them with training. We're currently actually doing the training now. So, they understand what we're looking to do with this technology. And all of them are super excited because it gives them really insights into what they can actually, because again, if it's virtual, the patient goes home, how can you really keep in touch with this patient? How can you really be able to see and understand what's going on? What data? I mean, there are changes The patient could probably has changed his nutritional plan or something that can trigger some data point and then some parameters that will probably not be within the normal reference range that you need to measure. So how can you really keep that engagement? How are you able to have that access and see that and then encourage to support this patient? So technology is one, the health coach is the human aspect of it. That will really provide that support and encourage those patients to really optimize and empower them, right? So the pilot is ongoing, and it's going to be for the entire month for the training. And then, because that's also something that we use, because we're also building under the diabetes program that we're actually building now for a company out there in Alabama. I'm not going to share the name right now, but they have one of their top cost drivers is diabetes. And they know that, okay, they had to find a way to really, it's a self-insured corporate organization, and they want to really drop the cost and also see how they can really keep their patient engaged and also keep retention. So how we were able to get to them was to say, hey, you know what, we have a different approach to healthcare. Really, it's not just about, the conventional healthcare system. We have a collaborative approach with the doctors, the dietitian, the health coaches. The health coaches are there to really support your employees, provide encouragement as an accountability partner, psychological support, moral support, really, because again, chronic diseases, diabetes, a lot of them are lifestyle driven. If you make some changes to, again, your nutritional changes, some behavior changes, that would really begin to address and reverse this disease condition. Because for us, the goal is just to minimize prescription medication and then begin to see how we can reverse this over time. So hopefully we're going to look at that over 6 months. And then the data that's going to come out of that is something that we can use as a use case to be able to really talk to whoever the health plan today and see. It's almost going to be like a clinical trial, because now you have over 600 employees, and then let's say 100, 200 of them actually are diabetic. And then they're using your program. And then you begin to see the value over 6 months. You begin to look at the data points. And the only way you can really be able to look at that real time is by working with the health coach, as well as using the technology, the remote monitoring piece to really dig into. And again, it's going to help us to scale. And then because, again, the patients are there, 600 of them, how many can you literally see in a day if you don't use technology, right? So the technology, the dashboard, you're able to see what's going on, how the data is trending, and then how you can really better support them if there's a need, and then you can bring them back in for support. So it's a huge opportunity for us to really partner with the health coaches as well as Heads Up Health to pilot out this program so that we can get data to be able to use that data and show that really this is really very effective in terms of reversing chronic diseases, addressing chronic disease conditions, not just diabetes as well, and then also showing that we can really engage with the patient, improve retention, because a lot of times, employers, their concern is with programs is how can you really encourage and engage our employee to continue to use a program. So, and then the missing piece there is the health coaching component and also the remote. Given that now everything's almost remote, that missing piece is the patient, the patient engagement side with the health coaches as well, right? So now with the data that's going to come out of that, we can be able to make a case with that and then go out there and then talk to stakeholders so that they begin to understand that, yes, we're really able to get the desired outcome that we're looking for, really. And then that's where I think will be the future. So yeah, we're excited, and then we'll continue to look into that. And then, we always love to also continue to collaborate with your the Functional Medicine Coaching Academy. Your health coaches are really, really an integral part of what we do every day.
This is so exciting to hear about, and we've been saying for a while that the future of coaching 2.0, is coaching plus AI and technology merged. So, Dr. Clement, are there specific ways that you believe health coaches can lead the way towards increased access to care for underserved populations? We've touched a bit on this, but can you describe your vision?
Absolutely. Again, this is another very integral piece of, again, of the puzzle that it's missing. Because again, we are like, okay, we have a program that is really very effective. And there are people who are like underserved population, maybe they don't have access to technology or they don't have access to healthcare facilities. How can we as an organization begin to also reach out to them? Some of them, they might have access, but again, maybe they don't have the ability to even pay, right? So I think one of the ways that we could really make that available, and then, like you said, again, we talked about the reimbursement, how, if there are codes, CPT codes that would help to really address some of those concern that is there. will help for us to be able to scale and reach out to some of those populations. Because currently at Evolve Health, what we're doing is, and all of our patients, either they pay out of pocket because we are currently not accepting insurance, but we understand the problem is the underserved population. Those populations are there, they don't have access. How can we really begin to look at that and support them? Because that's maybe where it comes with the collaboration with Medicaid, Medicare, and see there are ways that we could really work together. And then one of the reasons that we're doing a pilot now is to also get data to be able to show that, to validate whatever claims we're making when it comes to some of the chronic diseases like diabetes, obesity, hypertension. It's really, if you look at the underserved population, a lot of them, this is one of the key drivers for them, again, for hospital readmission, hospital visits, doctors visit, and all of that, right? So for us, it's important to get data, to use that data and go back to the stakeholders and say, hey, really, we have an underserved population that will need access to a comprehensive healthcare system, what healthcare system should be. Then with that data, maybe we can start discussing how, okay, maybe there's going to be a way to create some sort of CPT code that we can use for reimbursement, and then we can open it up and say, insurance should cover that. So for us at Evolve, that's the goal now. Once we have the data, after maybe 6 months or within a year, we can use that data to be able to make our case and then start discussing, engage with the stakeholders, and really let's provide access. Healthcare should be for everyone. It shouldn't be for a certain group of people. And then really, it's very important for us at Evolve Health, we're able to really access those underserved population that don't really have access to healthcare, that really need it. Because again, looking at people who are probably, within, who are not underserved, a lot of them understand what they need, how they can really better be healthy. Yes, but those who are underserved, they might not have the resources to do that, right? So how can we provide that support for those people to begin to understand, yes, healthcare should be for everyone. Healthcare shouldn't be expensive. Healthcare should be something that you can access wherever you are. And that's what healthcare should be. And then with health coaches, we would able to also provide some sort of education, build some sort of community relationship with different communities that will go weekly and provide like some sort of educational content, awareness, and all of that. So that's the vision for us at Evolve Health. And we'll be using the health coaches to really be able to do that outreach and then organizing this awareness within some of those underserved communities in partnership with some of the those communities that we identify where we think probably might be a good partnership for us.
Thank you. For everybody who is listening, whether you are already a coach, thinking about becoming a coach, whether you're a practitioner thinking about working with a coach, I hope that you are feeling inspired and looking ahead to so much promise in this profession. So I'd like to open it up to our panel and ask each of you if you had one prediction about how the field of health coaching is going to impact healthcare over the next decade. What would that be? So whoever wants to start.
Sandy, I can take that first. The field of health coaching I think it's going to be really, truly redefined after 2020. And I think it's because I think there's a recognition that a trust factor needs to be built and bridged, right? And so, I talked about this in other summits, but there's 4 rifts to medicine. There's the rift between the patient and the doctor. There's the rift between the patient and the insurance company, a rift between the doctors and the insurance company, and a rift between doctors and other doctors. And this has been so toxic in the medical world for such a long time that a bridge needs to be built in between. And the way that we bridge all those conversations are with our health coaching platform and getting the data and using automation, robotics, and artificial intelligence currently to bridge that conversation. And so I think that the health coaching entity is really the only thing that I can think of to bridge all 4 gaps and all 4 rifts in healthcare. And it's going to truly transform the way that we do things medicine hasn't really changed in a few hundred years. There's sort of this traditional one-on-one doctor's visits and sort of thing, but right now we have to leverage technology, because think about what's truly changing public perception. It's what's trending on YouTube, not necessarily what's published on the CDC guidelines, right? And so we have to change, and we have to be the ones that are trending as well. And so in the digital world, and in the importance of that, getting to that conversation to the public and education, events like these are really what's needed. But more importantly, I think this entire structure of medicine can be absolutely transformed with a health coach in the next 10 years.
Wow, absolutely. Well, we are dedicated to making that happen as we all work together.
Yeah, I think I love what you just said, Ching. And I noticed in an earlier question you had mentioned the word pain point. And what I see when I speak with physicians who are contacting our organizations, or physicians that I'm friends with, I see a lot of frustration because they enter medicine with a passion to help people, but then because of the way the system is set up, they only have a few minutes to help each patient. And that leaves many physicians extremely frustrated. And so I think that, in the next decade, health coaches have a real opportunity to ease that frustration that a lot of physicians and anyone working in healthcare are feeling, because they're not able to help patients and work with patients in the way they really want to. And so I think there's just this tremendous opportunity for health and wellness coaches to step in and not only solve the frustration on the side of the physician, but also better the outcome for the patient. So I think we just have to really draw upon that opportunity. And because this field is still fairly new and the standards are still fairly new, sometimes it's frustrating for health coaches because they are having a hard time getting out that message. But I think that if they just keep trying and keep learning and keep asking questions, learning from people like Margaret, you, Sandra, any of the leaders in the field, I think that we will get there and the conversations will expand and we will ease a lot of frustration for a lot of people in healthcare.
I actually agree with Leigh and also Dr. Rowan. I think, it's really very important to identify those pain points, right? Because like you said, there's a lot of frustration. So for us, what we did at Evolve is really, before we actually even started the platform, what we did, we had to conduct some more customer discovery, right? From both doctor's side and patient side to understand what are the pain points. How can we really better begin to get some more insights into the pain point? What's the one hair on fire problem, right? One key thing there, I think, again, when it comes to working doctors, the health coaches, it's communication. And also, we can also use data to really make a strong case. And one reason why, when I mentioned that we are conducting pilots, and again, with identify one chronic disease area where we build a program, and then we have the health coaches, the doctors all working together, so that again we can use that data point and begin to also provide training and also provide some insight into how valuable those health coaches are, in terms of like engagement, behavior change, support, psychological support, moral support, accountability partner. It's something that again we really need to begin to also that communication channel how to open, right? So one thing we did as well in our platform, we specifically said, every patient who comes in there, you have at least 60 minutes with a doctor. And then we ensure that the doctors are trained on our protocol to understand really what our approach is. You also have 45 minutes with a health coach who would also be able to help you to support and work with you and understand what the doctor recommended to begin to help you to implement that. So it's important. That's why, a health coach, you have your own time. After the doctors are done with this patient, the doctor specifically would have to recommend that this patient speak with a health coach. You have a 45-minute window to really talk to this patient. So, that's a way to encourage doctors and health coaches to really work together, because it's already established. You have a protocol in place. So every provider that you bring, you provide that training. I know it's not the easiest thing to do, but with technology that you have now, we can scale, right? So you begin to hire more doctors, because the doctors is also easier for them. They know that you can be at home wherever you are and then begin to see patients. But the important is the protocol that you put in place. It's important to ensure that everybody is well trained to understand really what your approaches are and how you guys are going to work together in a coordinated fashion. And again, it has to be interdisciplinary approach, because, doctors these days, like you said, 10 minutes, boom, you're in, you're out. It's so very transactional, right? So we know that that's the frustration with doctors. They want to do more, but because their hands are tight. So a lot of them now are beginning to look at identify areas, platforms like what we have today, because the doctors really care. And, but because their hands are tight, and, there's a lot of frustration, they just don't know what to do. But we continue to provide education, awareness, and then using data to really drive home our point, to see that this collaboration between the doctors and the health coaches, really, data is king. If you have a data, you're able to validate whatever claims you have and say, hey, based on this, we have health coaches and doctors working together. We were able to get the desired outcome. Within 6 months, we were able to even reverse diabetes. That's great. Everybody want to begin to look at that. The model will be able to sell our model to health plan, even employer. Because again, the goal is allow the employers, they have employees. They also want to see how they can improve productivity, minimize absenteeism, and help support the employees to get better. So, I think, like you said, really, it's going to be a lot of challenge, but I think we can really overcome some of those challenges as we continue to build a robust, comprehensive healthcare platform that will begin to encourage collaboration, because that's really key that is completely missing. Medical school, they never taught us that. As a doctor, okay, you're the one who make all the decisions. But again, how about the patient himself? It's important to carry the patient along when you make decisions in a transparent way. That's how you empower and optimize those patients. So I think communication, training, and really putting protocols in place that will support whatever we do.
So well said. Communication, collaboration, key. I'd like to throw out one final question to our panel before we take a short break. And that is, what are your thoughts on the future of group visits or group remote visits? Anyone care to comment?
Sure, I will. So one of the things that the National Board for Health and Wellness Coaching is currently working on very actively is the group coaching competencies. So we very much believe that group coaching is the way of the future, particularly in healthcare. I think it's a real opportunity for the physician and the coach to work together. And I think that we're going to see more and more group visits in healthcare as we move on. So I know Cheng had mentioned that you do group coaching a lot. So
absolutely. Group visits. So I always like to start from a philosophical point of view. And I think that going back to pain points, that when I talk to a lot of other physicians about group visits, they're not able to communicate effectively enough to the patients where the patients see that as a valuable resource, all right? And I think that group visits can be much larger if we put that as a valuable resource. So our health coaches run the group visits, but we also have a provider on the group visits. But that's the how, and I like to talk about the why we do group visits first. And my original why completely changed. So the original why is to develop as much value as possible to the patients, for them to be empowered to their own health. There's a transformed why. When we started doing group visits, about 6 months in, we kind of had an aha moment where we realized it was so much more valuable for the people in the actual group visits to just engage and connect with each other, because they feel like they're not alone, right? And I think the new why that we developed is to create a system of trust where it's in a controlled environment here in our facility. And at the same time, have people really focus on the information that truly matters. So it initially started as more almost like a kind of a lecture style. And it turned into people coming in. Every visit's different is because it's more of an interactive experience. And I think that does take experience. It does take a lot of experience to really run those groups. But where group visits are truly powerful is that let's talk about from the business side and let's talk about from the value side in the healthcare system. From the value side, we can deliver a lot of content and field a lot of questions, right? And we can also gather a lot of data to see what our patients' pain points are. From a medical business side, it's something that's scalable, all right? And something that we're able to have really good, meaningful conversations, but also in any business, we want to know what the customer's pain points are. And that's also true in medicine. We want to know what our patients' pain points are. And it doesn't matter what diagnosis they have, they're usually the same. I'm stressed out, I take care of too many people, I don't know what to do, or I do know what to do, but I don't know why I'm not doing it. And those four things can be addressed very easily in group visits, which we can't do as one-on-one physicians as well. And so that actually, from the business side, that brings a lot more value to the actual group visits. And also, after every group visits, my coaches and I have this beautiful kind of like high, if you will, of us actually making a difference that you do not get with one-on-one visits. And so it's really hard to explain unless you kind of been through the process. But I think that there's a huge and remarkable value in what these group visits can do, but we have to get the communication of what value it truly is out there.
Well, I know exactly what you're talking about with that feeling after the group. Elisa and I co-facilitated a group for years, and that's how we felt. It was so rewarding, not just for the participants, but for us as facilitators. So very encouraging to hear. Are there any other comments about group as we close our panel, or anything else that has not been asked or talked about that you'd like to add as we draw to a close?
Sandy, I do have one thing that I think is exceptionally important when it comes to coaching, if I may.
Absolutely.
I really want to talk about the mentality of coaching. And this is a philosophy called hero versus guide, right? And so I think that when I speak with a lot of physicians, we as physicians were taught to be heroes, but in reality, we should be guides because heroes suffer tragedy. Heroes are usually too tied to an outcome, and where poor outcome comes, there's burnout. That's why there's massive physician burnout. 46% of physicians are burnt out, and those are the only ones who answer the surveys, right? And so I think that from a coaching standpoint, the coaches are actually trained as guides, right? And the coaches are not going to be slaying dragons with their lightsabers for people. They're going to be giving the patients their own lightsabers. They can slay their own demons, right? And I think that if we put that guide philosophy into medical practice, the outcomes are going to be significantly better because people realize that I am my own hero. Mm-hmm. And that is where the true value of coaching really lies. And let's take an example of someone who's coming in to a physician. And this is a story that will always stick with me for the rest of my life. So what happens is someone comes in and they have a very clear viral infection. And this is earlier on in my career. I was first year out of residency. And they basically, hey, I want my antibiotics and I'll be out of your hair. I was like, well, I think this antibiotics is going to not do you very good. You have heart disease. There's 20% chance you can have arrhythmia with this particular antibiotic. And so that created a longer conversation. And then I remember leaving my office, and then 20 minutes later, my staff told me, hey, this guy just gave you one-star review on Google saying that you won't prescribe me antibiotics. And so that creates what's called a resentment mindset, right? And I still remember this because I had a resentful mindset. Why? I'm trying to do this patient well, but at the same time, I'm getting this one-star review, so it hurts. And anybody who's a provider, anybody who's a coach who's been through that, you know exactly what I mean. And so that patient is coming in for the physician being a hero. Does that make sense? And so instead of me trying to be a guide and making sure that the patients do well, but whenever you're in a situation right here, you know, in my facility here, you come in and our job is to educate you. And our language changes whenever we have coaches. And if someone's coming in for the same reason, and instead of saying, hey, you know, you probably had a viral infection, I'm going to ask you, what is the end result you're trying to achieve? Is the end result you're trying to achieve to get over this infection or whatever it is that you have so you can go on with your life? If that's the case, this is the quickest way that I know how. And then that becomes a different conversation. And so I learned that communication actually through my health coaches, where we're able to deal with chronic disease, but also speaking in a way where we're dealing with acute disease. And so I think that whenever a practice adopts health coaching, the entire practice, the providers, the medical assistants, everyone has a big change in mindset where there's an empowerment mindset and the conversations truly change. And so we become a guide rather than a hero. And I think that guide versus hero mentality is the biggest thing that's plaguing medicine right now. And I think coaching is truly going to be an answer for that.
So beautifully said. And everybody, I want to just acknowledge to Leanne and Dr. Clement, Dr. Ron, for your words of wisdom, your inspiration. The future is bright.